Doctors say these non-calcified plaques are more unstable and prone to rupture, potentially triggering sudden heart attacks. The case is now reigniting concerns over hidden cardiac risks in young adults. Cardiologists say this growing trend is increasingly targeting younger adults because early stage plaque does not always calcify immediately. Conditions like obesity, diabetes and smoking can silently damage arteries years before traditional scans detect the problem. Experts warn that many people in 30s assume they are safe because of age, fitness or normal reports, but underlying inflammation and cholesterol imbalance may already be triggering hidden artery disease. Doctors say a CT coronary angiogram can provide a much clearer picture of the hidden heart risk compared to basic calcium scan. Unlike calcium scoring, CT angiography can detect soft non-calcified plaque and early artery narrowing before a major cardiac event that can occur. Let me straight away go to my guest, Dr. Vivek Gupta, Professor Cardiology, and Dr. Nitin Kapoor, Honorary Secretary, South Asian Obesity Forum, Head of Endocrinology, Diabetes and Metabolism. Thank you so much, sir. We are talking about young people getting heart attack, silent heart attack. Your opening comments, sir.
Absolutely. This is a rising trend. This is concerning. And this needs to be specifically affecting the younger individuals. And why is it happening is the important question that we really need to address. And thank you for bringing up this topic. This is important.
Okay. So why is it happening? That's my question to you. Why are silent heart attacks happening? I think there's a bit of a line problem. Let me go to Dr. Vivek Gupta, sir. Thank you for joining me. So why are silent heart attacks happening?
Yes, I'm Professor Dr. Gupta. Thank you for this topic. It's very important actually. I'm a cardiologist by profession and I've been practicing almost for 30 years in Apollo Hospital, Delhi. And also before that, I worked in France. And today I was supposed to be in Paris actually. So Destiny wanted me on News9. That's why I'm here because at the same time, I had a scheduled lecture in Paris, exactly the same time, and which I could not come because I had some important work in Delhi, and it's okay. So silent heart attack means a heart attack without any major symptom. Symptoms, as we all know, are severe chest pain, which is radiating to the arm, or with suffocation, with sweating, with घबराहट, which is something non-specific, but it is very commonly told by the patient, घबराहट हो रही है. So if there is severe chest pain and along with the radiation, the ECG confirms a heart attack, this is actually a normal heart attack. Silent heart attack means the patient has no warning, neither warning, nor there is chest pain, a so subtle घबराहट which may not be mimicked with any cardiac problem, or a subtle a small episode of a palpitation or a small episode of a sweating, and the patient he goes for the ECG, and ECG finds to be a severe heart attack showing ST elevation in the anterior lead or inferior lead depending upon the artery which is blocked. At the same time, many times the patient can have a sudden cardiac arrest, which if not revived, and 95% or 90% patient does not revive, the patient will die. So we always say...
Dr. Gupta, my question is, earlier heart issue was supposed to be an old man's problem. What is happening is that suddenly young people are getting heart attack, people who are fit, they are getting heart attack, people who don't have symptoms, normal regular tests show that they are clean, they still get heart attack.
There is a paradigm shift during last... sorry, you may continue.
So I want to know what's your prognosis, in the sense that is it because of lifestyle, is it because of are we exposed to certain things which have dramatically changed the way our body is not shaped up to, like noise, less sleep, continuous working, constant source of those liquid or edibles which keep you awake, excited all the time, which your body 100 years ago wasn't working like that. Is it because of that, Dr. Gupta?
I will have to show you a diagram, not a diagram. I have a model of the heart, which is actually our heart is this is the same size about in the central part of the chest, a little to the left side. So heart is actually basically a muscular pump. It's just a muscular pump which supplies blood to the rest of the body. And on the surface of it, if I can zoom it a little, you can see the red colors arteries on the surface of the myocardium. These arteries are only 3 millimeter to 4 millimeter to 2.5 millimeter to 2 millimeter diameter, and they supply actually the whole blood through the aorta, which is this. And the basic purpose of the heart is only to supply blood to the rest of the body, and most important part is the brain, because first of all, the carotid artery, they supply the brain, and then of course the rest of the body is totally supplied by this. It's a continuous cycle, which is about 80 times per minute or 72 times per minute. The blood goes from the arteries and comes back to the vein, and then the whole cycle, which is the blood oxygenation takes place in the lung, and the system is so automated. And the blue color is actually the collection center part, and the red one is the muscular pump, which is pumping the heart. So these arteries are three arteries in the overall in the so heart. What it does is, first of all, it supplies blood to its own myocardium. There are three arteries which supply blood to its own cardiac muscle, so that the cardiac function should continue to happen. So what happens is, in the older population earlier, there's a cholesterol deposition which starts at the age of, even people say it can start even the fetal side, but slowly the cholesterol deposits in these arteries. And when these arteries get cholesterol deposit, at that time, when it goes beyond 70%, the patient will have angina. When it goes more than 90%, patient will have rest angina. And it is 100% acutely, it can lead to heart attack. It was happening mostly after the age of 60, 65, 70. Earlier, I'm talking of 20 years back. During this time, especially after COVID, we are finding young people getting affected very often. And even when the treadmill test or echocardiography test or ECG test done only few hours back or few days back is normal. Why it is happening? These cholesterol plaque, which is just 10 to 15, 20, 30%, they can rupture. Rupture means there is the area on the plaque. If you see the tube is an artery which is supplying the blood. Inside there is a cholesterol deposition.
I know,
and those cholesterol depositions, if they are soft, then they can have a platelet and a clot formation, which leads to complete occlusion of the artery within a matter of few minutes or few hours. And that is heart attack. So patient who has only 20% blockage few hours back or 30% blockage, which was not causing any problem. He was on the treadmill, he was on the cycle, he was on the gym, absolutely fine. These plaque, they have some irregularities on surface inside the tube, which is the artery. And these surface, when they get irregularity, they invite platelet and they form acute formation of the clot or thrombus, which leads to occlusion of the artery completely during the matter of few minutes. Young man who has a 20% plaque because of the lifestyle, because smoking, because of the high blood pressure, blood sugar, or high blood pressure, or mental stress, or COVID. Now we are adding COVID into it because COVID has a spike protein which was inviting thrombus formation, and we knew a lot of deaths were related to heart attack and a lot of deaths were related to pulmonary embolism, lung clot. That was happening in the COVID time, and that was the major reason for the sudden death happening in the COVID. And ventilated patient on ventilator suddenly died because of pulmonary thromboembolism. So COVID was actually, the virus of the COVID had a small property so that it can invite the thrombus formation. Somehow that is always there, and even 5 years have passed, or 6 years are gone, 2021 we knew, 2021. Still there is something which is still going on inside the body of the vulnerable people, not everybody, the people who are vulnerable. Who are the susceptible people? Those patients who have got family history of heart disease.
Okay, I think Dr. Nitin also wants to come in. Dr. Nitin also wants to come in. Dr. Nitin.
Right. I think a great explanation by Dr. Gupta, and just adding to what he said, and addressing the question why early, why we were not seeing this before. And I would say there are several reasons, and we need to step back, just one step back before the heart attack. Look at the risk factors, and the risk factors are also silent. Diabetes is known as the silent disease because nobody has symptoms when the glucose values are high. You talk of obesity and the Indian phenotype of obesity, where people have normal weight, normal BMI, but their body fat is high. So that is also hidden there. Cholesterol, when we talk of, unless somebody is really checking the cholesterol, nobody is knowing. But what we have seen in the last 2 decades is that the age of screening for diabetes, hypertension, dyslipidemia, that also has reduced. So I think if you just look at heart attack, we're not solving the problem. I think we need to look at the risk factors. The risk factors are also happening early. Earlier diabetes was a disease that we used to see in 50s, but now we see that in 30s. The official age of screening itself has come down by 2 decades. So I think it's important to tell our viewers it's not only the heart attack, but the risk factors are also moving before, and they're also
Dr. Kapoor, is it also because of the way ultra processed food, industrial food is affecting our body, which we think is okay, but we don't realize that this food is unreal. It's you know, it's a byproduct of the World War II, which is now there in available in supermarkets.
Absolutely, and I would say that's just part of the bigger picture. You know, we talk of these endocrine disruptors in the environment, the packaged food, the fast food, that is definitely part of the reasoning, but that's not the only reasoning. Our lifestyle has increased, our sleep time has reduced, we are stuck on to the phones, the stress, the cortisol level, all of that adds on and definitely has changed, you know, the way the risk factors have changed. So yes, processed food is one of the risk factors.
Okay, I've run short of time. Thank you both of you for joining me, because you know, we have decided in News9 that our normal coverage of news will have a very dedicated segment on health, because I think that cannot be ignored now. You know, the way you know, things are evolving, and the way health is posing to be a big challenge in a time when climate change, pollution is affecting all of us. So I thank you both of you for joining me.
Great initiative.
Thank you, sir. And this is all I had on Point tonight. I'll join you tomorrow at the same time. Thank you and good night.
First Battle of Panipat, 1914. Madhubani, carbon dioxide, Tropic of Cancer,